All right, welcome back. And for today, I've got my dentist, Dr. Vigorin. I've been seeing him for a number of years now. He's helped me with a tooth that I cracked, with a root canal, with a bunch of dental caries or cavities. And he's got a great approach to how to take care of your teeth. And he's educated me. We've had a lot of great conversations, but we've talked about the occult infections that are in your mouth. We've talked about sleep apnea, your airway. And today, what I want to focus on, because when people come in for regenerative injections, whether you're seeing me, whether you're going abroad to Mexico, Panama, Asia, or you're going to another clinic, one of the mistakes that people make, and I don't want you to make this decision or make this mistake, is not taking care of your teeth and having the whatever kind of regenerative treatment you're having focus on the infection or the inflammation that's in your teeth. That's unnecessary. You're wasting time, you're wasting money, and you're wasting resources. So, Dr. Vigorin, if you could help, and I'll ask questions, but if you could just explain and start to educate as far as these occult infections, why they're there, and why going to just your regular run-of-the-mill dentist probably isn't the best thing for most people.
Okay, well, thank you for inviting me, and you've been a great patient. And these are questions that people have that I'd like to be able to give some validity to the answers. Number one, let me give some background. I've been practicing for 50 years. I love it. I still come to work every day. You know, people ask me when I want to retire, and I say, well, I don't want my American Express card to work anymore. But you know, all kidding aside, I love doing it. I started with family. Those are all my first patients, family and relatives, and aunts and uncles, parents, brothers. Uh, uh, and when I was in school, it was important for me to uh, find the very best instructors and get the very best information from them and do the very best job I could because I knew I was going to have to take care of them for free for the rest of my life. And, you know, maybe it was a little self-serving at the time, but it gave me a different footing. And, uh, you know, people talk about holistic dentistry, and that's not about using a new technique or new material. It's about realizing that you cannot separate the person's systemic health from their dental health or their dental health from their systemic health. You're all
Right.
the same person. You know, it's like saying, you know, I'm a specialist in left ear. And, you know, it doesn't matter. You know, your right ear is attached to the same head and your brain's in between.
Right.
Holistic uh, dentistry, as far as I'm concerned, is integrating all the things we know in healthcare that benefit longevity, and even better than longevity, health span. You don't want to live
Mm-hmm.
old and be terrible. You want to live old and be vital. And so your teeth are part of this. So let me give a real quick, my sequence of things that are important, that are modifiable or that people can work on. Number one is sleep. That's the most modifiable factor in longevity and health. And I can go into that, and we'll do that probably another time. The next one is inflammation. Getting old is about controlling, or getting old healthy is about controlling inflammation, and then movement and exercise. And now you put in diet and micronutrients and all those other things. But as far as inflammation goes, I'm going to go back to the first two, sleep and inflammation. Dental infections are probably the third or the fourth most important thing that could be modified. And those issues just in dentistry are probably related in sleep to 2 to 5 decades of longevity, and in dental infections it's been pretty well documented that it's healthy teeth and healthy gums and bone. The people with those live on average about 1 to 2 decades longer. And it's not just longer, it's healthier.
Wow.
So, the whole idea is living healthy longer.
Yes.
Now,
Yeah.
you talked about people that are going into regenerative things. Your teeth, I call them white slivers. And if you keep them really clean, you have a lot less bacterial problems related to them. And the problem, or some of the things that I don't think are taught in dental school, and I have 2 decades of teaching at both SC and UCLA, is that people don't realize, they think they get decay because they have soft teeth or they inherited from their parents. And the first problem is it's a communicable disease. You get it from your parents, most likely, most commonly. And everybody developmentally has holes and cracks in their posterior teeth, in their back teeth. And the conventional wisdom is you just watch those holes and those cracks until the patient can come in and say, I put my tongue in this hole, or I think I broke this tooth. And that's like, well, I can't think of a bad analogy, but it's the furthest thing away that you can get from prevention and cost benefit ratio. So one of the things we do is we do sealants on 6, 7-year molars on children because it doesn't take any anesthetic. And that's good for about 3 to 5 years of slowing down decay. It doesn't stop decay, but it slows it down. And 3 to 5 years is about what the half-life of a sealant is. But by the time, then they get their second molars in and they get their bicuspids in on top and bottom. And now you have 16 teeth that have holes and cracks in them. Those holes and cracks, called pits and fissures, immediately get bacteria in them that cause both destruction of the teeth through decay and periodontal disease. And if you just brush your teeth really good, which most people don't do very well, and there's a reason for that. Most children learn how to brush their teeth by themselves when they're 3 or 4 years old with no instruction and no evaluation. And then you brush your teeth like a 3 or 4-year-old the whole rest of your life. But if you teach some of these preventive things to parents and grandparents, and when I talk about that, I'm talking about mothers and especially grandmothers are the most influential people in their grandchildren's lives when it comes to preventing, wanting to take care of her. That's when when the mother starts, she's so busy, she doesn't always have time. But the mother spends more time. But back to these holes, if you open these up under high magnification with microburrs and you do a really good job, just that process alone, not sealing pits and fissures or holes and cracks, but obliterating the hole in the crack. And by the way, this doesn't make the tooth weaker, it actually makes the tooth stronger, because this was a developmental crack or a hole in the tooth. And that hole or crack reseeds the mouth with disease-producing bacteria every time you take your toothbrush out. So you're constantly fighting this reseeding or recontamination of the mouth because you can't get to these holes and cracks. So that's one of the issues that needs to change, okay? Number 2 issue is you have to understand that most dental schools for the last 100 years worked or taught under naked vision, 1-to-1. And if you had 20/10 vision, you actually did much better clinically because you could see things and you could control your fine motor skills much more accurately, and you ended up with better results. And the dentistry was at a higher quality, and it wasn't the students' fault; it was their vision that was interfering. And so now we've gone to high magnification, microscopes, and photography to improve things by understanding them and by better motor skills. Okay.
Okay.
And when you do work under these pretenses, instead of work lasting for 3 to 5 years and failing on 5 to 10-year cycles, you can get 10, 20, 30-year life expectancies out of restorative dentistry. And I'm, blessed to see some of my work come back after 50 years that finally, half of it needs to be replaced.
Yeah, and that's unheard of. Having work done that's lasting for decades, like that.
And I have to claim ignorance. When I started doing this, I had no idea that my work was going to last this long. And after 10 or 15 years, when I started noticing it, I had no idea what I was doing that was different. And it took me about another 10 years to figure out, why was I different? And then for the last 20 years, I've been trying to lecture and teach those differences, but you're up against you're up against an impediment for change.
Yes. Yeah.
I call that the industrial, the billing industrial complex, which is insurance reimbursements, and what they pay for you do and what they don't pay for you don't want to try to explain to the patient, because it's not covered. And if it's not covered, then you probably shouldn't be doing it because the insurance company would pay for it if it was important. And that's
then you end up in this long conversation. People don't understand what's going on. And one thing that I was really impressed with, and I want people to really get a sense of this, because it is different enough. But when you are working in my mouth and you get to a place, you stop and you take high resolution pictures of my teeth, and then you show me my teeth. And it's incredible to be able to see, for one, that all of the diseased tissue is gone, that you've actually taken the time with these tiny tools and burrs to clean everything out, so that once you're now going to fix that tooth, there's no pathogens there. There's no bacteria, there's no fungi, there's no mold. And so I'd like you to explain to people what you see when you have people who've gone to other dentists come to you with caps, with fillings, with root canals, and what is it that you're able to see, unfortunately, and show to those patients?
Well, let me go back to the beginning, because there was a whole bunch of I say I learned mostly by falling off a turnip truck. I just fall off and turn around, and there's something there. But when I started dental school, I didn't realize I had fine motor skills that put me in the 99th percentile. I thought everybody could do what I could do, and I had 20/10 vision. I didn't realize that gave me built-in 8.5 power. I could look at something from 1.25 inches away and focus on it and see it. And as I told you before, all my work was done on, or 90% of my work was done on relatives. And so when I did my work at the time, you were told that you didn't have to take everything out, that it was just stain underneath in a cavity, and if you covered it up, it died. Well, that's like saying if you paint over termites or you paint over rust, it stops it. It just doesn't. And it was conceptual, and it was taught that way. And so when I joined the Air Force, or after dental school, I went to Japan in the Air Force, and they got lots of cameras there. I came home with lots of cameras, and when I started doing these little micro fillings, these pits and fissures to fill up the these holes in these cracks. At first, I compared to the norm, I was so aggressive that I was afraid that somebody was going to pull my license. Next door neighbor was saying, "Well, you didn't need to have that done. That guy's a crook. He shouldn't be practicing dentistry. You didn't have a big cavity yet." And so I photographed everything in Princeton and then showed it to the mother, who was generally there with the child. And my biggest argument was, no, I'm not doing them all today. I'm not traumatizing your child because you can see what's in those holes. Okay, we'll get them all done. Now, I still see some of those kids and some of their children now, second and almost third generation.
Yeah.
And that one mistake in my education, because when I looked in the preps and these procedures and I took it all out, the instructor said, "Well, I'm going to have to grade you down. You took out too much stuff that didn't need to come out."
Really?
And so for the rest of my career, I did what they said. And then as soon as I got my grade and they left, I took it all out. Well, that was the turnip truck decision that I made that turned out to make everything last so long. And then,
okay.
And then I found out when I got back here and I started taking photographs of stuff, and I had a video camera, one of the first little teeny lipstick cameras, that when I could show patients what they had in their mouth, that it was tremendously motivating. I could talk and talk and talk. You took a picture or a video and people were horrified. And then I realized, evolved into every time I do something and I'm trying to do the most durable, the best job, good that I can do to get the best outcome, I'm constantly making decisions on what I see a quarter of the way, a halfway, three-quarters of the way through the procedure. And I found out when I took those photographs and showed them to patients, and these were high magnification, high quality images, and now it's done on a retina screen with a 22 megapixel camera and a big lens, and it's a fairly heavy camera.
Yeah, that's substantial.
But the communication and the understanding and the appreciation by the patient allows me to negate the insurance company saying, "You didn't need that. We don't have a code for that. He should have done that all for nothing." And I found out early in my career that an awful lot of carriers would have a dentist that would say you didn't need to do that, and then you had an argument, and they could get out of paying for stuff. And when I started photographing stuff, I found the insurance companies all must talk to each other, because after I went up against them a couple of times, they never ever questioned my work the rest of my career.
Wow.
Okay. And
that says a lot.
That's because I could show all the steps and that I did all the steps correctly, and that compared to the norm, I wasn't normal. I was obsessive compulsive. And that goes back to early days in dental school when I didn't know what I was doing. I just didn't like to see the discoloration and the muck, underneath the filling. And I've had over 50 cameras. I lecture on communication and photography and dental photography, and those are some of the subjects that I've written and published on. But I don't want patients to trust me. I want patients to trust their own eyes. I don't want patients to take my opinion as the only word. I want them to understand why I have the opinion. I want them to understand why I do things, because when people understand, they always or almost always make decisions that are in their own best interest. And that's the basis of what I call high quality dentistry or holistic dentistry, or the most durable, the most valuable dentistry that you can have done. And now I'm going to get off into disassemblies and cleanouts. Those are two procedures that you learn first thing in dental school, and that every dentist forgets the first thing when they get outside, because there is no reimbursement codes for those.
For that. Okay, so we're talking about disassembly and cleanouts, and this is where you can address what you're seeing, some of this nastiness that you're seeing when people are coming in from other dentists.
Yeah, well, I kind of explain, I'm a little different. My job here is to take out bugs and bug poop out of your tooth. And, and I have lectures on this, and it shows that the inside of the tooth is like a bunch of glued together straws. And those straws have live cellular material in these tubules. And
Okay.
this is the shock absorber underneath the strong castle walls, the enamel, and it's what supports the enamel. And so a cavity isn't generally the decay destroying the castle wall or the enamel. The cavity is the bacteria getting inside and destroying the softer dentin root inside that has live tissue in it. And it's like an upside down mushroom, or as I used to explain, it's like a bunch of umbrellas, and all you can see is the handle sticking out, and you don't know if the umbrella is closed, half open, or full open. But when it gets enough destruction, and that's not just acid destruction, that's also collagenase or connective tissue destruction. What happens is the outer part of the tooth, the enamel, collapses into the unsupported hole. Well, that's what people call a cavity. That's what you got. Oh, I've got a hole in here. I can see a big hole in the tooth. And that's like, going to the fire after the smoke and the flames are gone. It's just too late. And that's what I see. If we could stop decay at the learning how to brush better and learning how to clean in between the teeth and doing pits and fissures, we never get to the expensive dentistry. Okay, and that can literally be $150,000 worth of expense over a lifetime. And what I say to patients or young mothers or young families is, if we do this to all the posterior teeth, your child will be able to take their family to Hawaii probably 10 times.
Sold. I like that.
So what would you like to spend time in here getting something done you don't like, or would you like to save your money and be healthier your whole life?
Yeah.
So that takes care of understanding why we photograph everything. And we don't photograph everything. If I'm just putting a small hole in the top of the tooth, I don't photograph that. But I photograph almost the starts, and the disassembly is when I take everything off of the tooth so I can see how extensive the internal contamination is. And then the clean out is when I take out all the contamination. How do I tell that? High magnification, you can see discoloration. You can see, you can tactily feel alteration. It's like drilling through a piece of pine into a piece of harder wood, and then into birch or mahogany. And the drill, you can tell when you're in different types of tissue. And so part of it is
texture change.
Yeah, part of it is tactile, and you can feel it, and part of it is visual, and you can see it, and that's done under high magnification. And if you take the photographs, the patient can see those differences also. So now when you get it clean, you get it disassembled and you get it clean, now you can actually, that's the first time that you can really tell what kind of procedure you're going to do. You can see if there's a crack in the tooth. You can see if there's an exposure. You can see how extensive everything is. You can see what kind of restorative material is going to hold up there. And we tend to do all of our restorative dentistry in composite bonding first, even if we're going to have to go back and do a crown. We get everything out, and then you've seen some of the crown preps. They look like they're totally unaffected teeth, and that's what we want to see.
Right.
Before the restoration, before the bonding, before the sealing, before the cementing or the impressions take place. And that's what allows us to get such good longevity and durability on things.
That's excellent. So let's finish this session for today with, how does someone tell if the dentist that they're seeing is really going to be servicing them and doing the kind of work that is the most up to date and is the work that you're describing? How do they, if they're not in the area, because you're in Newport, if they
Right.
can't see you, who are they trying to find, and how do they find a doctor like you?
Well, I used to say, and this used to work, and it no longer works anymore, find the best periodontist in the location that you're in. And it still should work. Find the best periodontist and ask the periodontist who the three best dentists are in the area. Who does his family go to? And that's because the periodontist looks at somebody over a long period of time. Orthodontist doesn't do that. An oral surgeon doesn't do that. A endodontist, a root canal specialist doesn't do that. They see patients for short periods of time, but the periodontist, the gum specialist, sees patients over long periods of time. And so how do you differentiate the very best dentist from good dentists or average dentists? Is how long their work lasts. And the periodontist that gets to see somebody's work over a long time, he knows who the best dentists are. The fly in the ointment came when periodontists stopped doing just bone and gum treatments and went into putting implants in. And now they're kind of conflicted, because to take out a tooth and put an implant in is a lot more profitable than saving teeth. And so we try to save teeth, and I can make a brag here or a claim that we probably do 90% fewer new root canals.
That's excellent. Yeah,
and we take out
that's excellent.
90% fewer teeth. And that's because if you try to save these things, it's hard work, but it's very fulfilling. That's why 50 years later, I still enjoy going to work every day. I save. I'm a tooth saver. Okay.
Yeah. And you helped me. You helped me save at least 2 of my teeth.
Yeah. And I'm a root canal saver, by not doing them, and then by disassembling and cleaning out. And another statistic that I hate to say, but it's true, is 95 to 98% of the root canals, previously done root canals, that we disassemble. And we disassemble them because they have leakage and decay on the edges, or they just don't look good on the x-ray, are contaminated. They're either poorly done, or they're done well, but they went right through a sewer and never cleaned it out. Or they're not sealed well, and no matter how well they're done, they've been recontaminated almost immediately. So when we open these things up, they smell. When we open these things up and we take a picture of it, it reminds you of the dirtiest place and the dirtiest bathroom and the dirtiest truck stop. It's just,
so gross.
It's disgusting. And that's why, I joked about taking bug poop out of teeth, but when I get
but that's what's going on.
Yeah, but when I get a 13-year-old boy that won't brush his teeth, I said, what those bugs are doing? They're pooping in your mouth. They're pooping in your teeth. You know, you really want bug poop in your teeth? And then the next thing is I say, that's right, you don't need to brush. And I get out 2 cups and I put a little bit of Clorox in each cup, and then I put a little bit of water in, and I have to mix them up so they see I'm doing the same thing. I have to use the Clorox, diluted Clorox rinse first, or they think I'm picking on them. And that kid will come back in a week and his teeth are immaculate because he didn't want to use Clorox rinses. Now, Clorox rinses work, but man, it's an acquired taste. It's worse than scotch or cigars when you know, if you're a 13-year-old. So anyway, you learn. And you know, the biggest complaint that people have about me is I'm slow and I charge too much and I lecture everybody. Well, guess what? You know, if you understand what I'm doing, I'm not too slow. If you understand what I'm doing, I'm underfeed. And as I said, I don't want people to take my recommendations just on the fact that I'm a dentist and I'm supposed to know. I want them to understand, because then they make decisions that are in their own best interest.
Yeah,
Okay.
and one thing, and we'll finish on this. One thing that I love is you show. You don't just tell, you show, and you get excellent outcomes. So, I'm going to put your contact information in the description, but do you want to just say what your practice is and where you're located?
Well, I have a website. I don't know what the website is. I think it's drvigorin.com or something. And we have little short snippets of videos on, you know, that I've done on these issues. And, you know, I'm even going to put some of these lectures in. So you can look up the lecture and see what I've been teaching for 20 or 30 years now. And, but I practice in Newport Beach. I'm a restorative dentist. Restorative dentistry is what every dentist learns in dental school. Now the specialties are restorative, our dentistry and different little segments of this. And after 50 years, if I can't do almost anything, I'm just not interested in learning. But teaching is the best tool to understand.
Yeah,
If you think you understand something, you don't really understand it until you have to try
you
to
teach
teach
it.
it to
Yep.
dental students or to patients. And so I've become an expert at learning that I don't know as much as I think I know.
Well, good. Thank you for your time. I'm glad we got a chance to catch up. I'm glad you got a chance to educate us, and we've got more to talk about. So we've got to talk about sleep apnea, airway. So we'll continue this at another time.
We'll also get into an awful lot of systemic things that you can do, that you do, that help patients with healthier bone and gum tissue and immune system. And if you can boost those things, and then I can take the bugs out of the teeth, and we can teach people how to clean around the teeth, because it's just a small pencil line around the tooth, all the way around, and that's in between the teeth also, right on the tooth above the gum line, where after the holes and the cracks in the teeth, 90% of all disease takes place on that pencil line. And if you can learn how to clean that pencil line, that's another 90% elimination of all future bacterial dental disease.
Excellent.
Okay.
Excellent. All right.
I
All
had
right.
fun.
Good to see
I'll
you.
let you go. Okay.
Okay. You take care. Bye bye.